Hey everybody, I'm sorry I was a minute late. My internet was giving me the spinning dial, so I'll give everybody a chance to come on and check in and say hello and tell me where you're from, and if you're struggling with scoliosis, or is this for your kids. I've already got a couple of questions pulled together from some of you from earlier in the week, so I'm really excited to answer your questions and just kind of talk openly about my experience with scoliosis in myself, in my daughter, in my son who had kind of a little bit of a scoliosis, and he may come in here and chitty chat with us in a few minutes. For those of you who are just coming on, go ahead and check in, tell me where you're from, and what's your affiliation with scoliosis, and I'm here to freely talk with you about any concerns that you guys have and what my experience has been over the years with this. So I only see two of you, so at least the two of you who are on here, go ahead and check in. Oh, there's four. Good. Glad everybody's coming on. Thank you for tuning in. I'm going to give everybody just a second to come on, because I think these questions are super important, and I want to make sure that everybody hears the answer. And just so you know, if you missed the live feed, I'm going to save it at the end, and it'll be something that will be stored so that you guys can rewatch it in case you missed it. You can share it within the group again. So, all right. Well, I'm going to go ahead and jump in and answer some of the questions from earlier in the week, and hopefully give you guys, some techniques and things that you can use. So I'm looking at my computer here. I just was trying to decide if I could see it without my glasses or not. Hi, Donna. Actually, you're on my list of questions to answer. I'm so happy that you tuned in. Hey, Maya, a little 5-year-old with scoliosis. Yes, we'd like to keep it that way as well. Hi, Jennifer Jenkins. So happy that you're getting some relief. So let me jump into the questions, and by the way, I didn't review them. One of the things that I like to do is just kind of be real and raw, and sometimes when I get the questions in advance, it feels like I rehearsed it in my head, and I don't want it to be that way. I want this to, be kind of the mom to mom, friend to friend, inventor to customer, kind of raw and real. So let me just jump in, and I will go ahead, since Anna Raposo, I hope I said that right, Anna, she wrote in earlier and said, hello, Ashley, thank you for your time and support. Wondering if you would be able to share your own personal experience with the fascia blaster and scoliosis. So my own personal experience, I don't know how much you guys know about my history, but I was a child born with juvenile rheumatoid arthritis, and I was a very competitive gymnast. Always had issues, particularly in the right hip. I can imagine that having hip dysplasia, arthritis, and then pounding with gymnastics would jam a hip, which is not something that was, talked about in the 70s, which was, when this was going on. And then more dramatically, when I was in my late 20s, I had a flesh-eating bacteria that actually got inside the bone, and it ended up, I couldn't immediately have a hip replacement because I was too unstable. I mean, it was really deadly. And so what ended up happening was I delayed a hip replacement, I think about 4 years, and my leg was basically fractured. The femur head was almost gone. It was beginning to show signs of fusion into the acetabulum, and so my doctor said, look, and he was a friend of mine, I totally trusted him. He said, you're about to be at the point of no return, and we need to get this hip replaced. And by the time that I, finally had x-rays and MRIs, which I had kind of avoided and just stayed away from hospitals altogether, not only was my hip really rammed up into my pelvis, but my pelvis had tilted, and I had walked around on it for so long that I had developed a lower lumbar curve that was almost, I think, 25 degrees or something like that. and then, you know, your body starts to compensate. And so I had a thoracic curve. Mine was the S curve. I had a little lordosis as well. But after the hip was replaced, and I decided to have my hip replacement abroad, I went to India to an expert because it was imperative to me that my leg length be the same. And I think that kind of one of the overriding things that I would say to the whole group is that your leg length and your pelvis need to be level, or the only place for the, you know, compensation to come out is really in your spine, because you've got all those independent joints that can just say, oh, I'll just tilt over here, you know. And then when you walk around like that and your muscles get tighter and tighter, and then your brain starts to process that as the center, you know, you end up in this snowball effect. And that's what happened to me. So standing with my, you know, making sure my hip is pulled out, making sure my hip replacement scar is open, all of that is really important to me personally, or else I do absolutely hurt in the low back on the right side, and I'll cramp up and I'll get a tight glute. I'll have SI joint pain. So for me, the name of the game is keeping everything loose and keeping the you know, legs the same length. So that was the first part of Anna's question. I hope that helps. Does blasting help reduce the spinal curve rotation, and for how long should we blast on our children's back, and any recommendation as far as the amount of time per week? Let me tell you that, so I can experience this as a mother. You know, I didn't have the fascia blaster when my kids were little, real little, but my daughter was born with scoliosis, and they told me that, you know, she would probably have to have rods by the time she was 12 and all this kind of stuff. And, you know, me, even back then, she's 18 now, you know, I knew that wasn't going to happen. I wasn't going to let that happen. So the short answer to this is you can blast your kids as often as they'll let you. I don't know if you said it in here. Oh, 14-year-old. I would start with the face blaster. I feel like the face blaster is the best one to kind of help get right up next to the spine, and you can come in with like a side-to-side motion. And what I found with kids about, you know, your daughter's age is that they like it and they feel better afterwards. But the hard part with any child is that, to me, there's really two components to this. If you have a, you know, non-genetic, you know, meaning if you have Marfan syndrome or Down syndrome, but if it's neuromuscular, or if it was, you know, developed from an injury, or if it's fascial, the hard part is that half of it is getting the tissue open so that the spine has the ability to realign, but the other half is being very, very conscious of being symmetrical, and taking your kids basically through like the wall test and teaching them, you know, when you're in your desk, you can't, you know, slump down and, you know, let a rib rotate. You know, they've got to learn to be very aware of that posture. Also, I would say definitely check her leg length. There's a great video. It's old, but I still love it. It's just called How to Pull Out a Jammed Hip. It's very important that their legs start off even, because otherwise you're swimming upstream. So in terms of blasting their backs, you know, I feel like it's one of those things that you're going to have the fixing it phase, and then you're going to have the maintenance phase. And during the fix it phase, you want to blast them as often as you can, you know, and keep the tissue loose and open, and then really work with them, you know, looking at those bony landmarks. You know, I used to put masking tape, like railroad tracks, in the mirror for the kids, you know, for my daughter and my son, and tell them, look, you know, line up your hip bones, line up your ribs, look at yourself from the side. Are you too arched? Are you too humped? You know, and when they're first trying to, you know, readjust, you know, from a neuromotor standpoint, it's really, really hard for them, and it's hard for them to remember it all day long, and to walk like that, and to sit like that. So anyway, it's a little bit of a challenge, but, you know, kids are definitely motivated by being out of pain. So I hope that answers your question, Miss Anna. Let's see. I'm going to go ahead and answer the live ones since you guys are on here. Anna, if you're still on here, will you just give me a little response to let me know if that answered your question? I know you're probably looking for like a regimen, but I really try to empower the parents to, just really work with their kids and explain to them how important this is and how they can prevent so many problems for when they're older. I can tell you that my daughter left to college, 2 semesters ago, and she's fascia blasting everybody in her dorm room. She knows exactly when her pain is coming on. She knows exactly how to fix herself. So I think the biggest thing that I could ever do for a parent is to empower the parent to empower their child so that they can, know how to maintain their issues as they grow older. So let me see. To read it on my phone, I'm for sure going to have to get the glasses out. These are my Mrs. Claus glasses. Okay, good. Anna, thank you so much. So Maya Henderson, I think you were actually on my list. Nope, from earlier. Maya says, how often for the maintenance phase? I think that it all depends on like all the other factors in your life. In terms of a maintenance phase, I'm really debilitated, and I have a lot of scar tissue. So for me, maintenance is, on a good week, an hour, 3 to 4 times a week. On a bad week, in the shower, 15 minutes whenever I can get it. So it all depends on how well you are working on your posture, where your feet are, where your pelvis is, if you're thinking about it all of the time, if you're exercising, looking in the mirror and reinforcing the proper biomechanics, then your maintenance, you might not only need to blast, but like twice a week. So they kind of go hand in hand. So my son just came in here. Why are you so bright orange?
Game day.
Okay, he's repping the Houston Astros, but I'm going to just turn actually, I don't know how to turn the phone. I'm scared I'm going to mess it up. So can you see yourself? So this is my 16-year-old son, Luke, and he presented with, if we had taken him to a doctor, with pectus. But you can tell him a little bit about your experience, because I think the hard part for moms with kids is teaching the kids how to
maintain themselves.
Yeah, maintain themselves, exactly.
So basically, I had pectus, which means that, one side of your rib cage pokes out, in a sense, further than the other side. And if I probably went to a doctor, I'd probably be diagnosed with early stages of scoliosis, too.
We're kind of not doctor people. So that's I don't have any problems with doctors, but in terms of like orthopedic type stuff, I feel like we're all on the right track with this fascia thing. But he never had an official diagnosis, but you could definitely see it. It was visible.
It was visible from the surface, and that was all from, I used to be really big into video gaming, so I would always practice terrible posture 24/7. In school.
Show them how you would sit. Like it was literally in a rotation.
It was literally like here, like this, but I would have this side of my ribs like twisted the whole time, the whole day. And
isn't that crazy, you guys, to think that something like video gaming could actually cause
something as simple as posture can cause pectus, scoliosis, and it's really a game of, if you fix your posture and you're aware of it, then you won't have any of those bad symptoms come along.
Now, Luke is my baby. He's the youngest. He's 16. So he had the fascia blaster pretty much as long as you can remember, right? Do you ever remember pre-fascia blaster?
11, maybe, is when I started fascia blaster.
So it started with me doing it to you, but when did you really kind of take the ball and run with it?
I probably took the ball and started running with it when I was around 13. And that was about a year before I decided I wanted to play football, but I knew I wanted to do something athletic. So I was like, I'm fat, I need to get into shape. So I started working out, but at the same time, I learned to maintain my body and be aware of things like posture, biomechanics, and, how to walk properly So in order I can start running properly, so I can play sports.
It was
better.
really the sports that kind of like brought it out. Because when he would go to train, he would be like, why is one, bicep growing more than the other? His chest was, looking strange. But to the moms, tell them, like, in order to fix it, it was literally like in the gym, in the mirror, unrotating yourself, being completely hyper aware.
Basically, as far as pectus, it literally takes you standing in a mirror and like looking at the part of your body that's not properly set and then moving. So if you're standing, you have a foot turned outwards, you look at your foot and you make it go straight, and then you go from there. So if you stand up in normal posture like this, hips out, this is normal for you. You have to look
right,
in
and
the mirror.
by the way, the feet being turned out is a compensation for the spine. So then when he would straighten his feet, then you could start to see it. And you had, if I remember correctly, we had a jammed hip and a rotated hip, and then the entire right side was rotated. Yeah, pelvis was rotated anteriorly right, and then the whole rib and everything.
So basically it took about 50 to 75 times a day of me just standing in the mirror, looking at myself and correcting everything wrong with my posture.
And what about like at school?
And like at school, because it's like a constant battle. It's like fighting an addiction, because if your normal posture is like this feels normal. So once you fix it into an actually good posture, it feels weird, it feels foreign, like anything you should feel when you do it the first time.
How long did it take? I feel like it was about 30 to 60 days for you to...
30 to 60
of
days.
Like really intense focus on
it. Like in class, I'd spend probably 45 times per class resetting my posture. About 20 seconds later, slip out of it, resetting it.
This is, by the way, the exact same process that an adult would go through. I know for me, because my main issue is my tissue in my hip, it is a constant battle to keep my foot straight and have it aligned with my knee and have it aligned with my hip. So they're asking questions, so I want to see if they have any. She was asking, do we have any videos on pectus? Maya, you're challenging me.
Make some.
I was going to say, we can for sure make some. Luke, he's old enough, we can start to put him on the...
I will donate my time to make a pectus video just for you, Maya.
Okay, cool. Both my kids look like they're developing pectus. It's great because... No, developing is not great. But knowing that it could come from something simple like, sitting in the video gaming chair. I'm guilty of, when my boys were young, my oldest is really a gamer, and he sucked my youngest into it, and I bought him those video gaming chairs. You remember those ones that were like curved and they had the speakers? And I was thinking, oh, I'm the best mom ever to get this, chair. But the reality is that takes you into this like mode. The start of a curve. And then I think if you start to incorporate that in your posture and walking and desk sitting and everything else, I actually think that can be part of what's causing that. So
if you're in school or if you're gaming 3 to 4 hours a day, then you develop this hunched over.
It's the equivalent of a repetitive injury. And people don't think about sitting still as a repetitive injury, but it is.
If you can't sit right, you can't walk right. You can't walk right. You can't run right.
And you certainly can't play sports right.
And you can't play any sports right. That's why most sports injuries revolve from something simple like mechanics or posture.
Okay, let's see. Do kids go through detox? I think, I have the same answer. I have the same answer for kids as I have adults. It depends on how toxic you are and where you're toxic. I know for me, sometimes I can do a full hour blast and nothing happens. And then, sometimes if I've had a week of poor eating or flying too much, then, I can get a headache or feel nauseated, or sometimes I'll spot, So you said yes. I thought you were going to say no. How would you detox?
Well, I think people that are younger don't don't necessarily.
You're not as gnarly as adults, I wouldn't think.
But the part that I was gnarly, the part that was causing my rib shift. So if this is my rib cage normally, basically what happened is it went like this, where the right side was poking out.
And caused a collapse on the other side.
And caused a collapse on the other side, so it kind of caved and went out like this. So we started treating my back to loosen it up so we could start resetting it normally. And when you would treat my
And by the way, when they say reset it, I feel like it absolutely is a mother and father's job, big sister, friend, whoever, you can see it from the back. So if someone lays on a therapy table, there's absolutely nothing wrong with, like, if you see the right side's up and the left side's down, you push the right, he's doing it with his hands, push the right side down and pull the left side up.
And it actually helps. And if you fascia blast and do all the techniques, then you loosen everything. Then when you do that, you can actually...
It just makes it easier for things to move.
It's more pliable.
Yeah. I was telling them before you came into the room that I feel like it's half and half. I feel like keeping the tissue loose, which is the therapy side of it, is only half the battle, and the other half is the biomechanical side.
Exactly. You have to keep your tissue loose so you don't get injuries, but you also have to
reset
everything.
And one affects the other.
Yeah. So if you have bad mechanics, it'll make your tissue bad. If you have bad tissue, it's going to make your mechanics even worse, and then it just spirals, and that's why there's so many injuries and tightness. Well, that's why everybody's so tight and fascia bound, because nobody's paying attention to it. But if you loosen yourself, you also have to reset your mechanics. So if you're doing a leg lift and when you're doing a leg lift like this, and your toes pointed outward.
Yep, you're reinforcing the bad.
You're reinforcing the bad movement. So
and by the way, with spines, it's a little bit even more intense because a spine is what we call load bearing. So when you're in a seated position, you're actually having to contract the intrinsic muscles of the spine just to hold yourself upright. And those guys are really difficult to retrain. So what I want to say is that it's not easy, but what I want to say is that it's worth it. It's for sure worth it.
Yes.
We didn't answer her question though. Hold on. Tasha Rowe, she was asking about the detox. What kind of detox would you have?
In my really gnarly areas, the back where it was just so fascia bound you couldn't even grab anything but the skin, I actually broke out like in bumps and hives.
Oh, that's right. Bumps and hives.
Bumps and hives and like little red blood blisters. Only for the first few weeks though, and then once it started getting loose, it wasn't as bad. But
when you say blood blisters, you don't literally mean a blood blister.
No, I don't mean like.
Don't let that get out in the universe. It wasn't like a blister filled with blood. It was just rashy and bumpy.
Explain it, but like.
Like a hickey?
Yeah.
He whispered it. It's okay. We can say hickey. It's grown women. Okay, let's see. So Maya is saying they game a lot. They're 12 and 15. Mm-hmm. So, well, now's a good time to start. I mean, I think that really all of it, just like this entire fascia blaster, fascia movement, it really starts with education, and even if they're 12 and 15 and they don't want to listen to you, trust me, when pain comes in the first time and you say, hold on a second, let me fascia blast your wrist, or, let me fascia blast your back, and they feel better, then you think they might not be listening, but, a week or two later, they'll come back and be like, hey, can you do that again? Kids are stubborn like men.
It's all about being aware, because you don't have to do it to them constantly, but once they get injured, they'll be like, oh, well, maybe it's not because of this, maybe it's because I have tight fascia. Yeah. And they'll look at it from a different perspective, and that'll let them take the initiative to see if it'll actually help.
Absolutely. Oh, she said 5. Oh, Lord, is that because I read that wrong? Do you have protocols for leg lengthening? That is Melissa Wright. Melissa, that is a great question, and we do. I mean, at the end of the day, if you want to lengthen anything, then you want the tissue as loose as possible. Are you out? Nope, I don't need you anymore. Bye.
Bye. Bye, everybody. Love y'all.
So, with leg lengthening and spine lengthening and, foot lengthening and arm lengthening and all of that, the key is to have loose, soft tissue and open joints. And so, in my opinion, you can, let's make it as simple terms as possible. Your soft structures are, your ligaments, your muscles, your fascia, the fluid system, and then your joints are just connections of the bones. So if you want to lengthen anything, you have several different ways to address the soft tissue. The fascia blaster is obviously a very powerful tool for doing that. Stretching can also do that. Massages can also do that. So anything that you can do to get that tissue loose, that's one side of it. The second side of it is having the joints open. And literally every joint in our body can be opened through traction, which is just pulling it. So that's why I'm so big on getting families, treating families, because there's nothing dangerous at all about, you know, pulling out a hip or pulling out an elbow or pulling out a, it feels amazing. And definitely with spines, you know, we do it here all the time. We'll have one of us, you know, hold the head and somebody else hold the legs, and we stretch everything out after blasting, and it's really pretty powerful. So let me check on the time here. So ladies, I have really enjoyed this. I'd love to talk about injuries, particularly things that I've had in my families, and I know it can be super scary. If I didn't get to your question, we'll definitely schedule another live feed. I don't know how much you guys know about what's going on with the company, but we are doing an international launch, and it has taken me out of the country quite a bit and taken away a lot of my time, but I am very much committed to doing regular live feeds in the groups so that you know, you guys can have access to me. That's always been my dream, was to create a tool to where more people could experience the benefits through the knowledge and the tool, and not actually have to physically come, you know, see me. So anyway, I really appreciate you. We got 16 on here, so that's good. And if you guys want to come over to Fascia Blasters, the main group, I'm gonna literally turn this off and come right back on in the main group, and you're welcome to ask questions, and if I see them, I'll answer them in the big public group. So anyway, everybody have a fantastic night. Thank you so much for being here and letting my son come and crash. I mean, I as a mom, I think it's good to hear it from the kids. So anyway, have a beautiful, blessed, amazing Sunday night, and see you guys soon.